Great.
All right, Suze. So this is our State of Project Search presentation. We do it every year. We highlight those things that have changed from the past year, those things that we're about to change because of the evidence. You all know we have the database. We use that data to see where we need to do better, and then we write grants and we work on those things so that we can bring new offerings to you. It's a really important part, I think, of what Project Search is. We're constantly trying to evolve and improve. Our ultimate goal is for 100% employment for every young person into the career of their dreams, not just a job, but a career. And so that's why we have these tools. It's why we work so hard to get better every year. All right, Suze. So I'm delighted to show you the data and the employment outcomes for the class of 2019. One quick reminder, we always collect data a year out, we're always a year behind, and that is because each team has 9 months to be in the program and then an additional approximately 9 months to work on completing employment for that class. So this year I am reporting on data from the class of 2018-2019. If you look at this first slide, you'll see that this year we had 229 award winners. That's the most we've ever had. We are thrilled. And we increased in absolutely every area, 70, 80, 90, and 100. We had a jump of 28 teams who improved their employment outcomes this year. So in terms of our program site data entry, we could not be prouder of you. And we know that the statewide coordinators have a huge role in this. This year we had 542 sites in Project Search, and that was a 75 site increase from the previous year. When I say this year, I meant 2018-19. This is where I get confused. So in 2018-19, we had 542 programs. Of those 542 programs, 534 of you entered your data into the database for 98%. That's really good any way you look at it, and we are thrilled. Hopefully next year we could get to 99% or 100, because the more data we have, the more accurate it is, but we're thrilled with 98%, so thank you. In 2018-19, our class size, for all intents and purposes, stayed same. We were right at about 8 people per class. We went down a teeny bit. That was because of the distribution across the curve, but in general, our class size stayed at 8. So this is our distribution. You can see it's slightly different from last year, and that is that distribution, the 3 highest were 6, 7, and 8. 8 was still the highest in terms of a distribution, but that cluster of 3 changed that average. All right.
So just know that we really do want you to have as big a class as possible. We know that COVID's going to affect that this year, but always keep increasing the class size when you can.
And actually, more important even than that, we want to make sure that your class size allows you to afford the cost of your program. So you should always have enough interns to cover the cost related to hiring the instructor and the skills trainers and the job developer. That is the ultimate goal, is to be sustainable year after year.
Absolutely, Erin.
All right, just a reminder, all the data you're about to see is based on the Project Search definition of competitive employment that we borrowed from VR years ago and that we still use as a hallmark of Project Search. For us, it is competitive employment if it is at least 16 hours per week, pays the prevailing wage, and is in an integrated setting among coworkers with and without disabilities. We say non-seasonal What we really mean is that we don't want the person with the disability to be the only person in a given industry who was hired for the summer or hired part-time. If many people in an area are hired seasonally, then it's okay. We're looking for folks not to be an exception to the rule in any given community. All right, here's our numbers. So in 2018-19, there were 4,166 young people enrolled in Project Search, our biggest year ever. The percentage who completed, or the number who completed, we had 3,868 completers, meaning that 93% of all the young people who started Project Search finished Project Search. We are looking at the reasons why we lost that 7%, and that's something that we're working on. How can we decrease that number? It stayed about the same every year, and it still is better than many other programs and special ed in general. We'd like to do better. In terms of the number employed, 2,907 of the completing population were employed, which means that 75.2% of all Project Search completers went on to get employment. The tricky part of this is that 75.2% of completers represents all types of jobs. And I'll show you that in a minute. What actually, if we're looking at it according to our definition, 65.2% of completers gained employment of at least 16 hours a week in an integrated setting, paying the prevailing wage. If we look at that distribution of hours for the 10% who didn't make the 16-hour cutoff, you can see that nearly 70% are working 10 to 15 hours. So they're still working lots of hours. They're not just working 1 or 2, but they missed that 16-hour cutoff. The other thing that we recognized is that COVID has had an effect on these numbers, in large part because young people were working virtually, job development was still ongoing virtually, our instructors and our teams were working from home for 3 months of the period when we were collecting data. And so we know we lost some information and some employment related to COVID. Suze? In 2018-19, our salary was the highest per hour average that we've ever had. And so the average hourly pay was $10.85. The average hours per week were 24.7. We've remained steady there, right at about 24.7, 24.8, right at 25. We're really happy about that because it tells us we can do better than 16. Our state minimum wage comparisons, if we compare those salaries to the state minimum wage adjustments for people with disabilities, we are still much higher in every single state than their adjusted minimum wage. And now we're getting into some of the really interesting slides. In 2018-19, we're looking at why interns withdrew before completing Project Search. And we're excited. We have Dr. Cleary, we have Dr. Buncher joining our team. And all of these things are things that we're going to be looking at as we set our research agenda. How do we do better? How do we, do we select better? What's happening that we're losing approximately 7% of all people who start our program before the end of the year. And the number one reason, and for the 2018-19 class, was poor fit. The second was conduct. Now, unfortunately, poor fit and conduct don't always give us much information. And we may need to add a survey that we send out to dig a little bit deeper into these things. But in general, I think we know what we mean. The third category is other. We don't know much there at all. And then it gets into medical concerns, poor attendance, relocation, incarceration, and deceased. And so those are the reasons that interns withdrew before completing our program for the 2018-19 year. In terms of disability categories, not much of a change from previous years. In the US and Canada, we still continue to serve primarily folks with intellectual disability and autism. In the United States, we don't often use the word learning disability, but they do in England, and that's why it's on this chart. But if you lump the three of those things together, that's primarily who we serve. The two that we see growing the quickest are other health impairments and mental health.
And Aaron, this slide always kind of is important because all of our sites want to know who are we supposed to serve. I think we're very happy that that big blue piece, that intellectual disability, has stayed the biggest, because that's who we were created to serve, was young people with developmental and intellectual disabilities.
Absolutely. And then in the UK and Europe, Iberia, it's largely the same. Intellectual disability makes up, and learning disability and autism make up the bulk of the people that we serve through Project Search. As in the US, the other two largest groups are other health impairment and mental health. So it's good to see, as Susie mentioned, that even though we have over 600 programs, we are serving the people we intend to serve, and it looks similar across all sites. In terms of race and ethnicity for the 2018-19 interns, the red line is the enrollment in Project Search. The blue is the US population. And so you can see there that in Project Search, 4.7 of our interns were Asian, compared to a population of 5.9%. So if we want to mirror population, we need to do a bit better there. If you're looking at Black and African interns, in Project Search, 20.3% of all of our interns are Black and African. That compares to a US population of 13.4. We are thrilled with this, and I'll tell you why. And that's because studies have shown for years that if you are a Black young man or a Black young woman, you are often over-enrolled in special ed. And because that's the case, we want to make sure we're also providing opportunities for those young people to be part of Project Search. In the Caribbean and West Indies, 0.7% of our interns compared to 0.25% in the population. First Nations and Aboriginal and Project Search were at 0.5% compared to 1.35% in the population. So we need to step up our game here. We have several programs on reservations and other First Nations lands, and we need to do a better job of serving these interns. 11.4% of our interns are Hispanic and Latino, compared to a population of 18.5, another area in which we need to improve. 0.4% are Native Hawaiian Pacific Islanders, compared to 0.2%. Other was 3.7 compared to 2.8%. And then white and European, our interns, 58.3% are white and European, compared to a US population of 60.1%. So we're pleased, but we also recognize we have some room for growth and improvement. Susie? So this is the other fun slide for me. I can't lie. I'm usually happy with many of these things. I'm unhappy about some of it. So we looked at our top 17 job types. People always ask why we do 17, and it's really kind of an odd answer, but that's because it's the number we could fit on one page and still be able to read it. So it's the number Mary Ellen and I chose. The number one job done by Project Search interns remains environmental, domestic, and housekeeping. Every year I look at this and I'm a little bit sad that it's the number one item, but then the rational and pragmatic side of me says, yes, that's true, but only 15% of all Project Search interns got jobs in these areas. And that's compared in the general population to 33% of all people who work in those fields. So at least I feel as though we're not over enrolling because people have disabilities. We're not simply placing them there, but I hope that we're doing it because it's what the person who's gone through Project Search wants. The other thing I can say about this, and maybe it's rationalization, I don't believe so, is that we know that most of our interns are getting environmental and domestic jobs in hospitals and corporations and large entities. And environmental services in a hospital where you get a pension and benefits and a lot of other positives, and you work as part of a team, that's much more prestigious and solid than it is working maybe at a fast food place where you're wiping down the tables, but then you lose your job and you start at another fast food. And I'd be interested in hearing what the rest of you think, but maybe that's my rationalization.
Erin, I also think our hospitality sites are growing.
Yes, that is true.
In beautiful hotels and resorts, and they're hiring a lot of our interns. So they are working where they intern, and for the most of them, it's probably a fabulous job.
And it's a choice because they chose to be part of that hospitality site, and 15% is a reasonable number. Our second change this year, we're really excited. Stocking materials management jumped into the second spot of all positions. This tells me that our folks are not strong readers always, maybe not the strongest counters always, are really doing well on stocking and materials management, especially if we provide the right accommodation and adaptations. The next four go to food prep, kind of the same thing. Those have been steady. And as Marty Zog just pointed out, almost 30% are food related. I would point out that among the US population, more than 30% works in food related industries. So we still are less than the average. And I want to make sure that, these are the dreams of the people we're serving. Probably the one that I'm disappointed about, and I know Susie is too, is the courtesy clerk, bagger, cart greeter. I wish this was not part of the top 17. The only time it's really acceptable is if a young person who comes into Project Search could not have been a courtesy clerk without the training they received during that Project Search year. And I have to be honest, I find that a bit hard to imagine, although I know I've seen it happen myself. And so only 5% of all interns went into that courtesy clerk, bagger, cart greeter position. And then we start looking at office admin, clerical, cashier, retail clerk. I love that the cashier is going up. We're looking at manufacturing, production, assembly, distribution center operatives also growing. Maintenance, patient care is growing. Child care, laundry and sales, and then patient transport. Before we move off of this, this is the kind of data we can pull. It's the kind of thing that we're looking to research. And as we look at how we can make sure we're meeting these individuals' needs and their dream career, and not just placing them in the job that's available at the time. Susie? The next slide is really fun. So this is the jobs, some other jobs, just a random number of jobs that are not in the top 17, but it gives you some idea what our grads are doing and a better sense of the numbers. Now, actually, patient transporter is in the top 17, but 64 of our graduates went on to become patient transporters. That's an awesome job. The trajectory there is huge. Your ability to rise up within the hospital, get pensions and benefits. 46 of our grads were front desk receptionists. 43 were data entry techs. 30 were employed as ground crew members, 28 as animal care technicians. And that's another one I'd love to know more about. So for the statewide coordinators, if you know what those animal care techs are doing and you have examples, we'd love to see some, because we really haven't heard too many stories. 24 of our graduates are working as clinical sterilization technicians. You talk about a crazy hard job that has really stringent requirements for quality and productivity. That's amazing. We have 17 of our graduates have gone on to be teachers and job coaches. We're thrilled. We're actually over the moon about that. And then 16 of our graduates have gone on to be laboratory technicians. This certainly is not a complete list. We don't have time to read that, but our folks are doing some pretty amazing things, and I'm really proud of the work you have all done in these types of careers. Thank you. Susan?
I think my favorite still is the coaches. I've met 2 skills trainers in the Nashville area that went through programs and then became skills trainers. And it brings me to tears, and they are rock solid. They are wonderful. And so just when that can happen, it's transformative beyond belief.
Yeah, we're really pumped about that. And we are encouraging sites to consider training job coaches. You know, your 3 internships could all be based around how to be a skills trainer or a job coach. Your internships could be with different staff, learning different techniques. So there's so much fun that could be done in that area. And it's something we'll be looking into more in the future, but we're pretty pumped about it. All right. Reasons for unemployment. Just really interesting. Now, it's key to remember that the number one reason is that the job search just has not been successful to date. So for about 35% of those who are unemployed, they've had an unsuccessful job search. At Project Search, we're looking at what that means. How do we up our content about job development? How do we work with you to make sure that we're getting this done most effectively? And we'd like to see that number drop off and not even be on the page. But if you look at the rest of the reasons for unemployment, the next largest is that they voluntarily left a job or quit. We need to figure out why. Many of them went on for additional training. Now that does include folks who went on for PCAs because they were recognized at work and we're going to get some additional safe coursework. The next one, however, education and gaining a credential. We have a few questions about that. So it looks like about 8% of those who were unemployed were going on to college or another program. And if I'm honest, and I was VR or DD, I would be concerned about this because Project Search is meant to lead to employment, not to another program. And and if they think they want to go to college or they tell you they're interested in college, when you're working on student recruitment and acceptance, perhaps those folks who seriously want to go on to college or take courses aren't the people you should be taking in the program. Or the other option is that we need to start talking to our young people about the fact that many of us go to college, but we do it part-time while working. I know lots of people who worked while going to college, and that certainly is also possible for our young people. The next reason is folks who were involuntarily terminated or fired. Some were lost to follow along. This increased because of COVID. We had illness and medical leave, family or personal leave. Quite a few relocated. And then we do have 4 COVID reasons this year that we just added. Hiring was delayed because of COVID. They were laid off or terminated because of COVID. They lost their job because of COVID, or they are not seeking employment due to fear of infection because of COVID. And then the last reason is pregnancy and childcare.
So, Erin, we're just going back to the relocated really quickly. I know that we have reached out to some of you, especially those of you that are funded through VR. So if we have a young person that moves from one state to another, I will often, and I know the rest of our staff does too, contact the statewide coordinator in that state, especially if you're working with VR, to say, hey, we've got an intern that's moving from here to your state. Can we hook them up either with a Project Search program or with a local counselor? And sometimes we've been able to do that somewhat seamlessly. So we need to maybe chat about how we can make a better effort to help those folks that are moving from one state to another, since we're in almost every state.
Yeah, for sure. So a summary of the reasons for unemployment for those 18-19 program graduates. 37% did not find a job by the reporting deadline. We must improve that. 18% chose to pursue further training or credentials. I'm going to repeat what I said, and that is, if it really is to pursue something that they figured out through Project Search, that's one thing. If they knew from the start that they intended to go to college, that's another. And we need to decrease those numbers. 10% could not work due to medical or family issues. 6% were lost to follow-up, and 5% experienced COVID-related job loss or delayed hiring. So the next section we want to talk about is COVID-19, and probably most of you know this movie, and it's like, Marty, whatever happened, don't ever go back to 2020. And I know Susie and I totally feel this way. It's been such an interesting, difficult year, and we know it has been for all of you. We want to talk about some of our strategies, some of what we're seeing. We want to announce some of the things we're going to be doing, and then this is what we want to talk with you about toward the end of today, after we've done our State of the State. We want to know what you're doing, what VR is funding, what you're seeing, and any ideas you have for moving through this time. I will tell you, just because you're such a fun group, and I know you'll get it. The first cartoon we had up here said 2020, and it was a picture of Ernie from Sesame Street. And then it said WTF, which is really how we felt. But we decided we needed to be more PC than this. It has started raining here. We're not going to stop, but I will talk louder. All right, Susie, can you go to the next one? All right. So COVID-19 has had, hold on one second. We're going to close a window and a door. Susie, COVID-19 has had a major impact on Project Search. There's no denying it. All of us are confronting the unknown, and we are facing many questions. Sites that were going to open in fall of 2020 have delayed until fall of 2021. Graduating interns have lost preparation time and employment opportunities, and employed graduates have been furloughed or laid off. Through it all, we will continue to support our teams in a variety of ways. Here is our COVID guidance. This is not rocket science. It's what we're trying to do, and hopefully you've experienced this as we work with you. Our COVID guidance is to be as flexible and creative as you need, while coming as close to Project Search model fidelity as you can. And I'm just going to repeat that. Be as flexible and creative as you need, while coming as close to Project Search model fidelity as you can. So just to be clear, we're not throwing Project Search out the window. We're not suggesting you do something totally different. We do have our limits. But at the same time, we recognize that if you're trying to follow model fidelity and you're trying to make it work the best you can, we are going to support you. And that's the bottom line. So no matter what, we're going to work with you. These are the 5 situations we are, the 5 situations that we are hearing most often from you. I am sorry, it is really pouring, and it's weird timing. So the 5 situations we are hearing most often is that our host business wants our programs back on time, but they want to do it with COVID restrictions. Number 2 is that our host business wants us back. They don't know when, they think it'll be later in the fall. The 3rd is that our host business wants us back, but we're not sure when. We can't even guess at it. The 4th is that our host business can't welcome us back this year due to COVID. And then the 5th is that our host business wants us back right now, but our school situation is uncertain. So I'm going to say one more time, no matter what, we're going to work with you. We're giving a lot of thought to everything that happens. We don't know any answers. We're not perfect. We can't guess at what's going to work, but we're glad to be on a phone call with you and talk with your team about this.
We also understand that everything is local. So many things depend on local school districts and local host businesses. So there's no way we can say everybody should do one thing or the other.
Thanks, Susan.
And so we've had many state meetings about this, but again, we're very happy to have individual phone calls and try to figure out how we can support what your local team needs to do.
So within the next few weeks, we will be posting guidance about what is acceptable as Project Search during COVID restrictions. We're starting with what is acceptable, and we will go from there. And we have 5 things, 5 pieces of guidance, and this guidance will ask you to do the following. Number 1, critically important, no matter what you do, no matter if you're virtual or live, no matter if you're in an alternative setting, we want you to ensure measurable skill gains. We have a team right now creating some concrete direction and examples of how instructors can virtually teach skills that can be completed and measured for quality and productivity. I'll give you a really good example. You know, if you have to do it virtually, maybe you have your young person clean out the closet, check expiration dates, and then front the shelves. But not just clean out the closet. They should have some productivity and some quality measures, because that's ultimately what matters. If they clean out the closet and it takes them 2 weeks, that doesn't help much when it comes to working productively in a work setting. So we'll be providing concrete direction in the next couple weeks, and you can look for that. But overall, please ensure measurable skill gains no matter where you are. Number 2, investigate existing online trainings and certifications that maybe just exist in your community or are provided through your host business. Most hospitals, for example, have first aid and CPR courses that you could take online. Many locations have a ServSafe food handler course that you could take online. If your host site's a hospital system, there's a program called Mosby Elsevier, and it's a digital teaching and learning platform. You can go in and you can learn a variety of skills. And once you've passed a small course or some questions, then you get a certificate, or you can check off that you've completed that digital teaching. In this time, if you can't get into your hospital till winter, see if you can get the hospital's permission to use those Mosby Elsevier teaching modules with your direction. Number 3, we really want all of you to use VocaFit. I think in the past, some sites decide not to do it, some do it. And during COVID and these uncertain times, we want you to use it. So this is a bit of a change. Begin using VocaFit to identify skills needed for competitive employment. And just a reminder, VocaFit is available on vocafit.com. There is a person Monday through Friday who sits at VoteFit and can answer your questions about getting in and how to use it. VoteFit includes 10 subsets of skills for a total of 135 total skills. Those 135 are broken down into these 10 subsets, and the 10 subsets are self-determination, cognitive abilities, safety, task-related abilities, and there's a lower and a higher, communication skills, physical abilities, general work attributes, work structure abilities, computer skills, and interpersonal skills. We would like you to fill out the VoteFit. You don't have to worry about doing it and comparing it to an internship, particularly if you're virtual. But remember, you can just use VoteFit to identify the skills of the intern. And then you can see as they grow, or you can see the areas that you need to focus on during either your virtual or your on-site training. So use VoteFit to identify emerging skills that lead to entry-level employment, and then concentrate on those skills so that you can move the intern to competence. Number 4, please use all available employability skills curricula. Susie mentioned that, the state differences. In many states and many school districts, they're basically telling you what you must use. And so we can't, we have to follow state rules. We can't circumvent them. In all cases with Project Search, please consider using our Project Search employability skills curriculum. It's currently under review.
Yeah, can you give me like 5?
It's currently under review, and Susie's going to talk about that in a minute. We are also getting ready to launch our Building Healthy Relationships curriculum, which Susie will talk more about, and our Health Matters curriculum. All 3 of these can be used at the same time. They address different issues, and they really bring some complexity to what you're teaching virtually. We know that a lot of our sites, a lot of our school districts use the Conover program. Feel free to use that if it's available through your education partner. And then we're very excited to announce that we just have completed 5 COVID lesson plans. They were prepared for us by an OT doctoral student working with Susie and team, and they are already available in the Project Search portal. The COVID lesson plans, there are 5 of them. It's social distancing, mental health, personal protective equipment, cleaning, disinfecting, and materials management, and hand washing, coughing, and sneezing. No matter what you're doing, if you're doing virtual or you're going back on site, make sure that you're using these COVID lesson plans or something like them every day for the first few months, I would suggest. We have to make sure that our young people are wearing masks, that they're maintaining social distancing, that they're working on hand washing. I will tell you that anecdotally, at Cincinnati Children's Hospital, we have about 55 employees with significant disabilities, and 16 of them remained on site in the early days of COVID as essential workers, which we're really proud about. But one of the things we noticed from those 16 is that they didn't really have trouble with hand washing or sanitizing, and not many of them had trouble with masks. Where they had trouble with was understanding appropriate social distancing. They still wanted to talk to their friends in the hall and give them a back slap or give them a hug. So anecdotally, that's an issue we really need to pay attention to. And then number 5, we can't be together as a team. Many of us can't. Please do everything you can to engage with all of your partners throughout the entire year, but especially while you're working virtually. Schedule virtual employment planning meetings for your young people. Include all team members. Resist that inclination to just schedule a Zoom meeting and have one person attend because it's easier. Write and update your continuity of operations plan. Most of you know we sent out earlier, we recommended that all teams do a COOP plan, a continuity of operations plan. We would like you to do that if you haven't already, and to make sure you're updating it frequently. We think these plans will stand the test of time. They're good. I don't know that this is going to be the last time we face a COVID-like situation. And so we probably all need to be having an updated continuity of operations plan. Please share your ideas on PS Let's Chat under the COVID thread. You know, while you're doing these creative, amazing things and working with your teams, put your ideas out there on PS Let's Chat so everybody can see them. That's the whole purpose and intention of that Let's Chat. And we'd love to know what you're doing. You guys are the masters at this, and we really want you to share it. Attend statewide calls. If anything else has happened out of COVID-19, our team we've learned a lot more about Zoom, Skype, and Teams, maybe more than we ever wanted to know, quite frankly. But as a result of COVID-19, we're having far more statewide calls. All of us are available for team calls individually with your team. You can schedule a call with us. Just reach out. We'll meet with your team, with your instructor, with your state. Whatever you would really like us to do. We're trying our best to be available and flexible and to meet your needs during this time. Don't sit out there where we can't see you and stew or be frustrated. Give us a call. Let us share your pain. And another great thing we'd like you all to do is complete a self-audit and set some continuous improvement goals. And you can audit your program virtually, and you can set improvement goals no matter where you're working from. And then finally, please take some time to celebrate, even if it's a virtual celebration, to get together and celebrate the small gains, the small victories through all of this. I don't know about you. I know Susie and I, we have our moments when we get really down and we miss our team members. We miss being together in the office. We're all working from home. It's not our favorite time for sure. And what we recognize is we all do better if periodically we have a Zoom call and we get together just to celebrate being. So please celebrate each other.